My name's Sarah Gall. I'm a student physical therapist assistant, and today I'll be talking about neuroplasticity and physical exercise. So most people probably work out for physical benefits, maybe to lose weight or build muscle, but today I'll be talking about how physical exercise can actually help improve the brain. So today we'll talk about what neuroplasticity is, who can benefit from it, what affects it. We'll talk specifically about aerobic exercise and resistance training. We'll also talk about how exercise can be used as a prevention. So neuroplasticity, also known as neuroplasticity or brain plasticity, is the ability of the brain to form synaptic connections in response to learning or experiences. These synaptic changes to the brain affect the structure and function throughout life. These are some helpful terms as we go through the presentation. Something that I'll talk about is neurotrophic factors, and these are proteins that regulate the survival, growth, and protein synthesis of neurons. I'll specifically be talking about BDNF, which is brain-derived neurotrophic factor, VEGF, which is vascular endothelial growth factor, and then IGF-1, which is insulin growth factor. And I'll talk about what those neurotropic factors do later on. Synapses are tiny connections in the brain between neurons that allow them to communicate. Neurogenesis is the process of building new neurons. Angiogenesis is the process of building new blood vessels. The prefrontal cortex is the area of the brain that is the center of planning, cognitive behavior, expression, decision-making, and moderating social behavior. And the hippocampus is the center of the brain for emotions and memory. Gray matter is where information is processed in the brain, and white matter is the area of the brain that sends information. Okay, let's just keep those in mind. So how can we develop neuroplasticity? There's many ways that you can develop it. Neurogenesis, which is making new neurons and creating new synapses between those neurons. Those are ways in the brain to build neuroplasticity. And synapses can actually weaken if they're not utilized. So that's why practicing and building those new synapses is important. You can also develop neuroplasticity through diet, experiences, learning, and today we'll specifically focus on exercise. So aerobic, strength training, and gross motor training can improve executive functions in the brain. Executive functions such as adaptive thinking, planning, self-monitoring, self-control, time management, working memory, and organization. So briefly, we'll go over what aerobic exercise is. It's activities that require oxygen and increase the heart rate. And then resistance exercises are exercises where the muscles contract and against an external resistance to improve strength, endurance, and power. So aerobic exercise affects on neuroplasticity. It increases blood flow to the brain. It increases the heart rate and the respiratory rate. Ideally, having a heart rate of 50 to 75% of your heart rate maximum, which is 220 minus your age, is a quick way to figure that out. Or having a rate of perceived exertion between 5 and 7, 5 being moderate, 7 being vigorous activity. These are the best ways to increase the production of neurotropic factors. So aerobic exercise can increase neurotropic factors such as BDNF, IGF-1, and VEGF. Increasing BDNF can protect existing neurons. BDNF and IGF-1 increasing can produce neurogenesis, and then BDNF and VEGF can produce angiogenesis. When neurogenesis and angiogenesis are produced or increased, it increases the survival of existing neurons, and it can also produce new brain tissue. So aerobic exercise increases memory and thinking skills and enhances positive moods, because you also release endorphins, and that it can protect against aging, injury, and neurodegenerative disorders. This is due to the neurogenesis and angiogenesis occurring. So a study that focused on aerobic exercise had young men 18 to 25 years old They had 6 different exercise conditions. They either did moderate exercise for 20 minutes or 40 minutes, vigorous exercise for 20 minutes or 40 minutes, and then a control group that did nothing, or they did nothing for 40 minutes or 20 minutes. So they found that the study, or the groups that did either moderate or vigorous activity, had an increase in BDNF levels. The vigorous and long duration group had the highest amount of BDNF levels increased, but they also found that the sedentary group had a decrease in BDNF factors. BDNF, neurotropic factor. So aerobic exercise can increase that, which protects against existing neurons. Another study that focused on the hippocampus had people walking just 10 to 40 minutes. It gradually increased each week that the study went on for, and they had to get their heart rate between that 50 to 75% of their heart rate max. They found that the hippocampus increased in size. They also found that BDNF levels increased again. The stretching group, which was the control group, they actually had a slightly decrease in hippocampal volume, and that's probably due to the fact that the hippocampus shrinks 1 to 2% annually in older adults without dementia, and this can increase the risk for developing cognitive impairments later on. So now we'll look at resistance exercise and how that can affect neuroplasticity through a study. 63-year-old men, so senior men, did resistance training 3 times a week, either at a moderate intensity, which would be 50% of their 1 rep max, or a high intensity, which would be 80% of their 1 rep max of an exercise. They found that IGF-1 levels increased, which promotes neurogenesis, so new neurons. It also improves cognitive performance. They also found a decrease in something called homocysteine, and increased levels of this is associated with impaired cognitive function, Alzheimer's, and cerebral white matter lesions. So decreasing that is a really good thing, and they found that resistance exercise can do that. Other types of exercise that can affect the brain are yoga and meditation and Tai Chi. A study where people did yoga and meditation for an hour each every day for I think 3 months, they found that they increased their BDNF levels 3 times as much, and then they also reported feeling less anxious. So I think it's known that yoga and meditation can decrease your anxiety levels, but it can also help with your BDNF, your neurotropic factors. And then Tai Chi can increase functional connectivity in the brain. It can increase gray matter volume in the hippocampus, which involves memory. So it demonstrates reduced age-related brain atrophy. So these are just other ways they don't get your heart rate up as much as aerobic exercise, but you can still see benefits in neuroplasticity. So this is just a visual showing different parts of the brain that we talked about related to different exercises. So lifting weights affects the prefrontal cortex, cognitive thinking, reasoning, yoga affecting the emotions, fear and anxiety, aerobic exercise affecting the hippocampus and memory. Now we'll talk about rehab after a brain injury, specifically a stroke. And this study, or when you have a patient after a stroke, the goals are to limit the severity of the initial injury and minimize the loss of function. And you also want to reorganize the brain to restore and compensate for any function that's already been lost. So Kleiman-Jones has a study, or an article, talking about different principles you should include in your rehab for these patients. They talked about use it or lose it, use it and improve it, repetition and intensity mattering in what you do. We've talked about use it or lose it and use and improve it kind of with resistance training, how if you don't utilize a muscle, it's going to atrophy. Same thing goes with the brain and the connections you have in the brain. You have to utilize them. Like I said earlier, synapses can actually weaken if they're not utilized. So practicing and specific skills improves those synaptic connections in the brain and can really benefit stroke patients or any neurological patient. This study looked at Parkinson's patients specifically. They added in an aerobic exercise where they did forced cycling. Forced meaning 80 to 90 revolutions per minute 3 times a week for an hour, and they had to do this for 8 weeks, so 2 months. This was a pretty intense study because it was a long time duration and it was pretty quick, the speed that they had to go. But they found that the brain scans that the patients had looked like they were taking medication when they weren't. They had less tremors, they moved quicker, and the patients reported feeling stronger. They also scored higher on clinical tests, and these results lasted even in a month after the study was over. So even when they stopped cycling, they still had lasting effects. And I think this visual is pretty strong in the evidence, is that post-exercise, the activity in the brain is actually more so than even when they were on medication, and then obviously more than if they're not on medication. But I think it's just a good way to show that aerobic exercise can be an alternative or just something that is very beneficial to add into someone's program if they have Parkinson's. Physical exercise can also be used as a prevention. Some studies I looked at midlife adults and children. So midlife adults, they weren't active. They started adding in physical activity daily into their lives. Then they looked at those adults 26 years later, and they found that these adults had improved memory, processing speeds, and executive function. They were also less likely to develop dementia later on. And then looking at school-age children that were physically active, they performed better academically. They had increased cognitive function, and they also had greater hippocampal volume than their peers that weren't physically active. Okay, I have a quick video just about BDNF and physical activity, explaining a little better.
Exercise is good for your body and your brain. Here's what happens to your brain when you exercise. Your heart rate speeds up and your body starts to work hard. Your brain recognizes these responses as stressors and responds by releasing chemicals that protect you from stress. BDNF and endorphins. BDNF repairs and protects your memory neurons and clears your mind so you can make good decisions. Exercise also increases blood flow to the brain, improving brain cell activity and focus. Increased oxygen in the brain as a result of increased blood flow creates new cells in the parts of your brain that control learning and memory. Endorphins help reduce discomfort, block feelings of pain, and cause pleasure. These feelings can last for hours after you have finished exercising, which is why you feel happier, more relaxed, and less stressed after a workout. Regular exercise over a long period of time can help protect you from anxiety and depression, increase brain cell function, improve your memory, and may help prevent many diseases. Regular exercise may also improve your self-esteem as you feel more confident about your looks and what you can do. The Centers for Disease Control and Prevention recommends that adults get at least 150 minutes of exercise per week. Just 30 minutes a day of walking, moving around, or even dancing can build a stronger, healthier brain.
Cool. Okay, so in closing, neuroplasticity is the brain's ability to change and adapt as a result of an experience. Today, that experience we specifically talked about was exercise. And exercise has positive impacts on the brain. It can improve cognitive function, increase memory, and neurogenesis and angiogenesis. And everyone can benefit from physical exercise. Neurological patients can especially benefit, but so can children and adults. Thank you for listening.